study that closed about 20 years ago. It really started 30 years ago. And that study really was designed to look at whether or not hormones, estrogen and progesterone, impacted heart disease. But what they found in that study was that there was no impact on heart disease, and it increased the risk of breast cancer. And because of that, hormones stopped being used for the last 2 decades for women going through menopause. What we now know is that study was flawed. That the women in the study, many of whom were over the age of 60, so beyond menopause, a lot of them were even 70 years of age. They looked at a combination of estrogen and progesterone, but when they looked at only estrogen in women who were actually in menopause, they actually recognized that there was a decreased risk of breast cancer. And not only that, a controlling of those symptoms. So we should not have to suffer from hot flashes, night sweat, all the miserable brain fog during menopause. This is, even though it is a natural phase of life, there's nothing wrong with feeling good. And women should stop thinking that you have to suffer. I'm suffering through this. I'm suffering. Why do you have to suffer? So there's nothing wrong with feeling good, and there's nothing wrong with talking with your doctor about feeling your best. In addition to that, if that's not enough for you, we actually know that women's risk of heart disease is much less prior to menopause than after menopause. In fact, after menopause, it begins to equal that of men, and that is because of that estrogen. We also know that heart disease is part of an inflammatory process in the body, in the entire body, and also in the arteries of your heart. And estrogen, has anti-inflammatory properties. And if that's not enough for you, Black women suffer longer symptoms, more severe symptoms, and a greater duration of symptoms as well. And we know that now we're starting to see more and more information that the severity of your hot flashes also